So it's 5:30, just turned to 5:36 p.m. on November 23rd, 2020. So I am calling this evening's meeting of the Ayer Board of Health to order. The first thing that we have, I see that we do have Attorney Ringwald. There's a section for public input. You come right after that, so you're not really public input. So anybody, any public input?
It's not.
No. Okay. So then, next thing on the agenda is the deed restriction request for 2 Rattlesnake Drive. So if you'd like to, Mr. Ringwald, take us through your request and the rationale and so forth. We did get all the documents.
Good evening, certainly. My name is Bruce Ringwald from Goldsmith, Preston, Ringwald. We're an engineering land surveying firm here in town, a couple doors down from you. Also with me in the room is Kelvin Moore, trustee of ZLM Real Estate Trust. And on the phone, but muted at the moment, is Attorney Thomas Gibbons. So we're all here. So as it states in our application, or our package to you for this evening, we're hoping to have the board endorse a grant of restriction for a 2-bedroom restriction on this property. The real estate trust property is 84.5 acres, give or take a little bit. It has had a 2-bedroom home on it since 77, as is evident by the assessor's records and the package that was submitted. The existing house had an addition done to it at some point in time, adding on a trophy room. But the property itself has 6 rooms in it, and it has 2 bedrooms in it as it exists today. We also attached the proposed plans, and I can share those, any of this stuff with you at any point in time you want. But we did the proposed plans based on a total room count, where we had 5 rooms on the lower level and 4 rooms on the upper level. These are large. Some of these are very large rooms. Some of them are hallways and bathrooms. And then only 3 of the rooms are not pass-through rooms, are rooms that could conceivably be bedrooms. We also attached with you a layout of those actual bedrooms, and there's 1 on the upper level and 1 on the lower level.
And then for a minute.
Yep.
Tom Gibbons just called me. He says he cannot unmute.
So Tom Gibbons is trying to unmute, I guess the same problem that Bridget was having. What did you get Bridget to do to be able to unmute?
Can Cindy do that? Can Cindy?
No, Bridget just called in again.
That's
So just
Tom.
hang up and call in again.
Start over.
Okay, we'll have him do that.
Okay.
I'll keep rolling while he does that.
Okay.
So then we also did a room count, so that it showed the actual bedrooms that are on the property. It is a large home, but a number of these rooms are pass-through rooms. The gallery is opened up to 2 stories. And the walls that exist on the lower level are primarily there from a structural standpoint to hold the upper level up. We had according to Title V, we need to do a location Title V, but we had a full-fledged Title V done of the system rather than just a location Title V. And the system passed Title V, which is not surprising, even though the system is of several years old, 40+ years old. There has always only been at the most 2 people living on the property. When George Sullivan was alive and Zelda was alive, it was the 2 of them.
George Moore.
George Moore, rather.
George Moore, yeah.
I was just reading George's name because he was George Sullivan, because he did the original soil testing. So slip of the tongue there, pardon me. But George and George passed away back in 96, I think it was, and Zelda was there for quite a while. So for the last 24 years, there's been only one person on the property, Zelda. And then after Zelda died, Calvin moved into the house. And so there continues to be one resident, and hence no real surprise with the very limited flow of the system. The system
Mhm.
itself was a 20 by 40 bed, preceded by a 1,000-gallon septic tank. And the old
Yep.
Article 11 that was designed by was 645 gallons. So the system, much like many systems that we do on large lots for smaller homes today, was designed for more than what was being built, just so that there's something there for add-ons or whatever in the future. And I know from having a call from Bridget earlier today that they found a copy of the septic permit. I'm not sure if it was found at Town Hall or if it was found at the Board of Health office. But that septic permit is labeled as for a one-bedroom home.
Correct.
Part and parcel of that is George Moore was trying to keep his taxes in check, even though he had an 84-acre property. The labeling on the septic permit didn't help him any because as taxes show and the assessors show, it's been assessed as a two-bedroom home and taxed as a two-bedroom home for 44 years. So I guess that brings us back around to where I was at the very beginning is that we have a grant of easement, and I see Tom has still got unable to speak there. Oh, no,
He's in.
Can you hear me now?
Yes.
can hear you.
Yes.
Can you hear us, Tom?
Okay.
Okay.
Yes.
Thank you. Yes, I can hear you.
All right. So I've just been going through the history here, Tom. You haven't missed much. So where we're at is that we've had a two-bedroom unit on the property for many, many years with a larger system than necessary for two bedrooms. And we have a proposed large home with only two bedrooms in it, and have provided you with a grant of restriction for two bedrooms. And along with that, and along with the additional Title V that we did, one of the things that our office has suggested to Calvin is that in order to try to keep his system in good operating order, that when he goes to build his house, we've suggested that he remove the 1,000-gallon tank and put in a 1,500-gallon tank with the appropriate effluent T-filters, just to help ensure any effluent from migrating down to the leaching system. And as you can see in the Title V, there is an outlet. I can't remember if there's an outlet T or a baffle, but one of the other is still there and still in good shape.
Okay.
So that's what I have for information, which was a little bit more than what we submitted.
Okay.
Turn it over to you for any questions.
So one of the things that I've had a hard time determining with all of these documents is what is the design flow for the system and where is that documented?
The design flow for the current system?
Yep.
All I have.
Because that's your proposal, correct? Is to keep the current system
That's correct.
with the deed restriction. Okay.
That's
Yeah, for the current system.
And the design flow that I have, or the information that I had prior to today, was a sketch showing a 20 by 40 bed and a soil logs that were done by George Sullivan and witnessed by the Board of Health that have a 6 minute an inch perk rate.
Yep.
So based on the Article 11, which is what this was done under in 77, the guidelines for that would equate to 645 gallons a day. But obviously that's not necessary for a one or two bedroom home. That's way more than that. The bedrooms were designed under Article 11 at 100 gallons a day, not the 110 we use today.
Okay, so the design flow is documented where?
I have not seen the design flow documented anywhere other than in the system sketch that was accompanied both in your files and with information that we submitted to the Board of Health as a 20 by 40 bed with a 6-minute-an-inch perk rate, which would be appropriate for Chatfield soils, which are Chatfield Hollis rock outcrop are the soils in the area that typically get between single digits and low double digit perk rates. So that seems appropriate.
Okay. So you're saying that the design, like the default design specs under Article 11 were
They were 100
100.
gallons per day per bedroom.
Okay,
And when you look at the flow for 6-minute-an-inch flow and divide the leaching field that was designed, a 20 by 40 field, by that flow, you come
Okay.
up 645 gallons per day.
okay, so you're backing into a design flow of six.
Just going with what the flows were. I'm not saying that that's the design flow by any stretch of the imagination, because again, we're
Okay,
looking to
All right.
keep the same 2 bedrooms that are there today.
okay. And so I know that you mentioned that you spoke with Bridget earlier, and so you understand that the only permit that we have on file for that property is a 1-bedroom.
That's correct.
Okay,
With the same, a 1-bedroom permit with the same flow that, the same leaching area. It called for a
Mhm.
1,000-gallon tank and an 800 square foot leaching area, and it called out the same soil depths that we have on the septic soil testing log from Perkins Associates and Charles A. Perkins Company, and
Yep.
a 6-minute-an-inch perk rate. So all that jives. That is correct.
okay. And under the existing Title V, what would you be required to do to be in full compliance with existing Title V?
Under the existing Title V, you're talking flow-wise, because flow-wise at 110 gallons a day for a bedroom,
Yeah.
but also from the design rate of 6 minutes an inch is about half or a third of what it was then. So it went from 1.2, I think it was, to 0.7. So it'd be 480 gallons a day for the 800 square foot leaching area.
Now, what would Title V, what would you have to do today to be in full compliance with Title V?
What would I have to do today to be in full compliance with Title V?
For the proposed building? Because you're removing a 3,881 square foot house and replacing it with about 7,200, it looks like, maybe, give or take.
6,200 is what I'm told.
6,200, okay.
Yep.
And you're aware
Taking out a
of some,
2-bedroom home and putting in a 2-bedroom home. So it's no new flow. It's the same flow from the standpoint of a 2-bedroom to a 2-bedroom. Hence,
but you understand how Title V today, as it reads, determines what design flow you have to have based on number of rooms, correct?
Yes, that's why
So-
there's based on number of rooms, and which is why I gave you all of the room counts that we have. And we've also given you a grant of restriction because the property is looked to be used by Calvin Moore. And again, very low flow, 1 person on the property.
So under the existing Title V, I just want to make the comment that any new construction, which this would be, it's a total tear down and replacement, you have to assume 3 bedrooms,
Why?
regardless of how you, because that's how Title V reads.
Title V says that you shall design for the minimum sizes of a 3-bedroom. Does have a clause that allows for a smaller system to be designed with a grant of restriction. But
We're not talking about the restriction, though. That the question was, what would you have to do absent the grant of restriction
you would
to
design,
come fully into compliance?
you would design for a 3-bedroom system, but we have a system that's larger than a 3-bedroom system presently in place.
May I interject, Pam?
Of course, yes.
So I think it's important to note that the approved capacity that we have based on the permit is 1 bedroom, regardless of what the assessor says.
Right.
And the as-built submitted by the engineer also is for a 1 bedroom. Again, it doesn't matter what the assessor says. We're going by the approved capacity based on the permits that we have obtained from the Ayer Board of Health office. More importantly, it is considered new construction because it meets all the criteria for new construction. So with that said, they would need to, at least based on the plans that they submitted, design for at least a 4-bedroom house. Again, we don't go backwards. What's there, it doesn't matter. We have no proof of how many people live there, what the use was, what has happened in the past. Right now is what we're looking at. And what we are looking at is a house that's going to be torn down. It's going to require occupancy based on the building inspector giving that occupancy permit. And the room count exceeds 8 rooms. Again, the approved capacity that we have on file is simply put 1 bedroom. So it doesn't matter what the code was in the past. We're not going backwards. Moving forward, it's recommended that they replace the system based on Title V, what we have on file, and that's how I look at it.
Well, that's what
Mr. Attorney Tom, can I speak?
yes, of course.
Yes. So I'm wondering if your records, and what's the date of the record, the last record you have in your file?
Record for
permit
what?
is the permit?
You said you found records that indicate a 1 bedroom, but are there any other
Yes, that's,
records in there about it?
No.
we have the septic permit from 1977, and we have the installer who put the system in from 1977 as well.
So at some point in time, the town realized it's a 2-bedroom system, and you don't have any records to that effect?
No, it happens all the time. It happens all the time. We're not notified when an assessor goes out to do an inspection or a walkthrough. We don't know who put what in finished basements without permits. We don't have knowledge of that. What we do have is, for the here and now, for the purposes of this meeting, the facts are that the permit was issued in 1977 as a 1-bedroom home. What happened after the fact, I don't know, but the design capacity is based on what we have on the permit. Moving forward, the system.
I guess what I'd say is, oh, sorry,
Yep.
go ahead.
It's okay. There is lags.
So am I on? I'm sorry.
Yes, yes,
So what
you
I would
are.
say is,
You are.
I guess which records are not complete? Is it the Board of Health records or the assessor records? But I understand what you're saying. I think what we have here is a working system that is more than sufficient for 2 bedrooms. The Title V allows the owner to submit the 2-bedroom deed restriction. That'll get recorded at the Registry of Deeds. So that house will never be used for more than 2 bedrooms.
Again, as discussed, we have a tear down. The facts are it is required to have, under new Title V, a 4-bedroom system.
That's not true. The case is that if you have a grant of restriction, then you are allowed to have a house be added on to, built, new, replace an existing one.
Right, but in this particular case, we have existing documents supporting, what we have is the existing system. We can keep saying the same thing. It should be a new system based on the size of the house, the room count, the permit that we have on file, and the information that we have. The system does not meet compliance with Title V now because the house will be considered new construction, you have to meet those requirements in Title V. And I understand that all what you're saying about the deed restriction, but again, the here and now, building a new house, it should be replaced with a new system.
There's a difference between your feeling that it should be replaced and what the law says. And the law does not say that it needs to be replaced. The law says that when you do an addition or you do a replacement structure, regardless of that replacement structure having bigger rooms or smaller rooms, if you're not increasing the design flow, and we're not increasing the design flow from what...
Based on Title V, you are increasing the design flow.
Yeah.
So from the standpoint that the permit says 1 bedroom, yes. So the Title V also has under section 15030 that the Board of Health is the record keepers. And there was an addition done to this house. Does the Board of Health have records of that addition? And what does it say at that point in time?
We don't have records for that addition. Do you have the permits from when that was done? Are those in the records for the property?
I don't know. I haven't looked yet. I'm having a hard time trying to understand why this is such an aggressive approach, that a working system that is clearly much larger than is necessary for the use of the property is being approached as can't be done. And between the applicant, Attorney Gibbons, and ourselves, we're providing all of what's been asked for and more from the standpoint of documentation. We're a grant of easement to keep it at 2 bedrooms. We did a full Title V for compliance of the system, when all we needed to do was show a location Title V to show where the system was at. We're offering to put in a larger and compliant with current Title V septic system, septic tank, to help ensure that the leaching field stays evident and working. So I'm just kind of confused as to why this is such an issue. I mean, many communities...
I'm sorry, I don't mean to interrupt you. Because the reason we're here tonight is to determine whether or not that deed restriction will be granted. So you're discussing this as though you have the deed restriction in hand, and that's not the starting place. The starting place is what you have documented records that you're permitted to have. And that is a septic system for a 1-bedroom home. Under current Title V, going by room count, you need to account for a 4-bedroom home. Another concern that I have, and actually I have an issue with the Title V, but I think it's going to become moot, in that there is the question, has the system received normal flows in the previous 2-week period? And that's checked yes. And yet you're telling me there's a single occupant.
That's
so
the
how
normal
is
flow.
that normal flows for a 2-bedroom?
Yes.
Well, that would be normal flows for the use of the property. I mean, that I think if you took that position, then you could challenge an awful lot of Title V reports. That's normal flow for the use of the house.
So are you saying?
I think
I'm sorry. Go ahead,
Pam. I'm sorry.
Yes.
I think at the end of the day, what we're looking at is the use of the home, and although there might be one person today, that house could be sold theoretically tomorrow, and you could have 20 people move in. What we're looking at is an applicant that is tearing down a house, putting up a new house. The system that we have has an approved permit for 1 bedroom, and the new house, with the room count being generous, or, we could count a couple of other rooms because they count as rooms, maybe not bedrooms, but adding to the room count. We'll say four it would be a 4-bedroom house based on the actual
Yeah.
room count that Title V states. Again, going by what Title V says, the system should be a 4-bedroom house. Again, whatever it was in the past doesn't matter. We're not going back. We're talking about a new house that needs an occupancy permit from the building inspector, is considered new construction. How are we going to move forward with that? And again, it could be sold in a year, and you could, like I said, have 20 occupants and, you know, a major problem. But right now, the
Yeah.
board
I
The
have
purpose
has
of
to
the
make the
deed-
decision.
The purpose of the deed restriction is to make sure that doesn't happen. So, as you know, inspection is done at the sale of every house. There's
Mhm.
usually a bank involved, and you know you've got a 2-bedroom deed restriction. I guess the same could be said about any home that was sold if people over-occupy it, but that's not reality.
The reality is it's a system that needs to be replaced according to Title V standards. That's the
The-
reality, and that's what the facts are.
But you
Based
don't
on what we
disagree
have,
that
Well,
you don't
the-
disagree that it passed Title V, right? I'm assuming you don't disagree with that. You've got the report.
the
we have
report
a
said it passed the Title
V.
V,
We have a Title
but that's
V.
not the point.
Well, no,
Right,
right.
the
Let me,
point-
let me finish.
Yeah.
And Bruce has just stated that based on the design of the system, it's well more designed than for a 2-bedroom, the flows.
That's
you've got to work-
1977. We're
No.
talking about here and today, which is why I keep saying we're not going backward. We're moving forward.
Right,
The
but Bruce,
past doesn't matter.
Nowhere
Under today-
in the,
Sorry, I can't hear what Tom said. What did you say, Tom?
Did you say that so taking that system under today's design standard, you're still at about 480 gallons per day,
That's correct.
and we need 220.
That's correct.
So
you
I'm
need
not sure.
440.
Or
You
even
need
330.
440.
Or even 330.
You need 440.
Okay, so 440, we're at 480.
Nowhere in the
Inform-
Title V documents is the design flow stated. It's not stated on the original permit. It's not stated on the current Title V. In fact, it's rather conspicuously absent. So the only thing we have to go on to put a stake in the ground to say this is what we know the system was built to is the 1-bedroom house.
Well, that's not true.
So
I'm sorry, but that isn't the case at all, because you have the soil testing data, you have the perk rate, and you have the 800 square foot leaching area written out on your.
then can I just ask you, why is this not stated in the Title V? There are numerous spaces here for design flow and they're all empty.
All right. They're empty because you have a Title V inspector who has certain things to go through. And when they go through and they do their things on their inspection, if it's not written anywhere and it's not written on your 1-bedroom permit that you folks found, then he doesn't have a flow to put in there. An engineering firm
Right.
has the Article 11 available and the perk rate, and the square footage can easily calculate what that design flow was, which is what we did. And the design flow at that time was equated to 645 gallons a day. Now, albeit they probably made a bigger system than what was needed. It was a 2-bedroom house that was built from the very beginning, and it was equated in tax for that over this time frame. Now, I understand you don't want to go backwards, but I think what Tom was saying a few moments ago is that the Title V allows for the applicant of a property to request a system be done for and restricted to a lesser flow. And that is what they have done. We have done that.
Yep.
As the applicant.
You have done that.
That's
You have
correct.
made that request, absolutely.
It's not so much of a request as it's a right under Title V for a homeowner to put a grant of restriction to restrict the use of their property. And that is what he's doing.
You're going to have to explain to me where in Title V it says that you have the right,
Certainly,
not to request, to obtain.
certainly. So in the definition of a bedroom, under the
Yeah.
definition section,
Yeah,
the last sentence says the applicant may design a system using design flows for a smaller number of bedrooms than
Yep.
are presumed in this definition by granting to the approving authority a deed restriction limiting the number of bedrooms to a smaller number. It's very clear, very
if the
straightforward
permitting,
language.
if the permitting authority grants such deed restriction.
No, it says
That's what we're
by
here for
granting
tonight.
by granting to the approving authority. It doesn't say
Okay.
the approving
Is-
authority granting it.
Is
Tom,
there
do you
any
want
discussion
in
here
here,
at this,
Tom?
is there any discussion at this point we need to have about whether the owner of the property has the absolute right, or whether, I mean, have we agreed that this is required? We are the public health authority that must grant this? Or are you
Pam?
asserting that it doesn't even need to do that?
You do not have to grant it. Essentially, in certain situations where someone might be building a house, I've done deed restrictions where they finish a basement
Yep.
and they have, they go over the room count, but it's just whatever it is. It's just a finished room in the basement that's going to be used for, a kid's playroom or whatever. At times like that, when there's an existing house, they've done a deed restriction for things like that, but you are not obligated to do it. In this particular case, again, taking the facts into consideration with the age of the system, the permit, the information that we have on file for that system, and then the house being considered new construction because, again, it meets all the definitions stated in Title V for new construction. They need an occupancy permit. Doing the room count, again, we're looking at a minimum of 4 bedrooms. You could even push it to say 5 based on a room count. Again, even if rooms don't have windows, those rooms are rooms and still count towards the room count based on intended use of the rooms. So you are not obligated to have to do that. Again, we're not talking about a system that was built in 2015 under current Title V standards. We're talking about a system that is 43 years old, maybe. Am I doing my math right? So again, you're not obligated to do the deed restriction.
Well, isn't it?
And I don't think the situation, I honestly don't think the situation warrants it.
And I spent a lot of time with all of the documents for this myself, and that's really what I'm seeing too, because Title V, as it goes on towards the end of Title V, where it's discussing about these variances, there are some requirements that have to be met, and the local approving authority has to agree to granting that. So
If we're
I think
going
we're
for
at
a
the,
variance, I agree, 100%.
okay, so I think we've pretty much got the facts down. Trish, do you have any?
No, I'm taking notes, I'm listening, and I mean, if that's what it says, a newer construction, it has to be for 4 bedrooms, and according to the plans that were submitted, that's a lot of rooms. And at any time in the future, you have to think about future, and if it's sold or more people are in it, I get it. I understand that, why it would be that way.
Yeah.
Legally, they're saying that they should be granted this, and it says so, but there's some language there that I'm wondering about. Mr. Ringwald says that it to, and what was the other word that you used when you were talking about granting the deed restriction, that it was a right?
Yes, it says that they can grant, the applicant may grant to the approving authority a deed restriction limiting the number of bedrooms to a smaller number, quote unquote, Title V.
Right. Does not state
So that-
that the approving authority must agree to receive that grant. So if we've got the basic
I-
facts of this down, I would say that we are 45 minutes into our allotted 1 hour meeting. We do have other things on the agenda. So if you would give us a little time to deliberate, please, you'll, of course, stay on the call.
Mr. Gibbons has been trying to speak for a little bit, and I have another comment as well.
All right, by all means, go ahead.
We've waited
Yeah,
over a month to get on the agenda as well.
Okay.
So if I may, I understand the board's position. You're worried about what's going to happen there in the future. Someone else buys the property. That's the whole idea of the deed restriction. A deed restriction, oftentimes, we're representing an owner that would want to avoid a deed restriction. He's offering the deed restriction. It creates a 2-bedroom system. It gets recorded at the registry of deeds, and the
Right.
protections that the town has through the Board of Health is that that's there, and if someone else buys it, then they understand it's a 2-bedroom system. So I think it's form over substance. Someone had asked about the building permit. I mean, perhaps we can go through the building department's records and find it, but the steps, and I don't know when that addition was done, but I assume the Board of Health at that time would have had an opportunity to review things. And the fact
It
that
would not have,
Submitted to us,
actually.
yes.
We don't have it. The whole process was different. We just started the review process interdepartmentally, I think, within the past few years. And again, it's not uncommon for us not to know when additions go on. At times, builders are not required to even get Board of Health sign off for additions, so we don't know about them. It happens all the time. We have finished rooms, finished basements, things that go on without permits, garages, I mean, you name it. So we would
Right,
not have
and I-
record of that.
That's
we're not
particularly
talking about-
true in Ayer. I just wanted to comment because we have really very few homes on septic. So I think that that's a lot of our mismatch between the assessors and building permits. If it's, a small addition on an existing home, I think that's
Right, but
why
we're-
perhaps.
But we're not talking about work being done without everybody knowing about it. You know exactly what's going to be done there. You have Bruce telling you that as an engineer, this thing is designed, probably over-designed for what we're asking for. And the 2-bedroom deed restriction protects everybody, puts everybody on notice. So it seems unfathomable that you got an operating system here for the proposed use, and you make them do a whole new system.
Well, I'm finding it a little incredulous that you believe that this, and I know you're an attorney, this is your stock and trade, but that a deed restriction is going to really have any effect on what happens while the current resident is still there. We may be talking, long live Mr. Moore, by all means. We may be talking 30, 40 years down the road before this property ever changes hands and the deed restriction comes up. And in the interim, there is no mechanism. There is no mechanism for Board of Health to enforce that deed restriction.
So you think that Calvin is, retiring and having a home that he can have a trophy space for display of the things that he's acquired over the time, and that he's going to want to have 20 people living in the house with him? I mean, is that what
This
you're
isn't about
no,
the current
please,
owner
please,
or
wait,
his
wait.
life situation. It's about the house in the room count, and let's just stick to Title V.
Okay.
Right, Bridget,
So,
hold on. I just
Yeah.
want to make this really clear. We are not talking about Calvin. We're not talking about the trophies. We're not talking about the Moore family. We are talking about an Ayer resident, for all practical purposes, nameless, faceless Ayer resident who has come before the board with this request, with the facts that we have in front of us.
correct.
I can't make assumptions on, but he's got a trophy room, so he's not going to want too many people living there. That's not how this is done.
I don't know that, because I do know that
Okay.
it's dealt with the actual issues of what's on hand and what we're looking at. And when you look at those rooms, There, Bridget and I've talked about a number of different rooms, but almost all of them are pass-through rooms. They couldn't be closed off, and if they were closed off, you'd still have to pass through that room to get to the next room because there's no hallway around it. And a bedroom is not that. A bedroom cannot be a room that's a pass-through room by the Title V definition and by the way it's been reviewed. So having listened to all of this and heard a bunch of things, thinking outside the box here, because doing a new system on the property is going to involve testing and designing a new system that's going to be a lot of expenditure of funds and time, especially where we're going into winter and spring. So just thinking outside the box here, and I'm thinking if we were, rather than replacing the septic tank with a new larger septic tank and an effluent T filter, if we replace the septic tank with an IA tank, such as a jet or a BioClear type system that essentially cleans the effluent even more, takes it from 160 to 230 parts per million in TSS, biological oxygen demand and total parts per million, down to below 30 on each of those. And when used in a upgrade or remedial situation, allows for a 50% reduction in the system. So you could then say that the leaching field, if this were done under a remedial, not saying that it is, but just to equate these, that would then make that leaching facility equate to an 8-bedroom or a 16-room house, which is way more than the numbers that I've heard thrown out there this evening. And we would still give you a deed restriction on the property. So you would get a deed restriction with a homeowner that's not going to be having other folks living there because he's laid out a home that enables him to have pass-through spaces. And again, these walls are there for a structural support for the upstairs. The upstairs walls, if that's a big issue, we could remove those even more. And we'd have a passing Title V, and we'd be maintaining that leaching field even more by only sending clean water down to it. And to the point of your concern that it's a bigger, larger system that someone could be in there, it's now got treatment that would allow for a much larger home than what we've got proposed.
Are you amending? Yes.
Again, we have a system that went in 1977 under the old code. What we need to do is have a system put in and designed under the new code based on new construction.
Well, we would like to have that. If that, first off, I'd like to have the board respond to that offer that we just made.
Well, I was just about to ask you if are you amending your request?
I'm not amending. Yes, I am amending the request. It's still a 2-bedroom grant of restriction, and it's still all the material that I gave. And I'm saying that the applicant would be willing to put an IA tank in place that would treat the effluents so that it was clean water going to the existing leaching field.
Bridget, have you had any background with that?
I honestly, no. And again, it would need to meet current Title V standards. So I have no idea what they're talking about without having it in front of me. But again, this actual system itself should meet Title V. So if
you haven't had any experience with IA systems? I can't.
With IA systems, yes. When you say an IA tank, what do you?
IA system is a jet system or a fast system are all tertiary treatment in the tank, and the leach field is the leach field. So it's the same thing.
I don't know that it's the same thing. Again, and I can't say without having the paperwork in front of me with what you want to do, if it meets today's current standards. Again, we're looking at a system, and I don't understand with all of that and the expense for that, why not just replace the system?
Well, the expense, I guess that's the expense for that is $4,000 or $5,000 and an annual maintenance fee. and allows him to continue to move forward with construction versus trying to do testing in the winter months. And
The testing can be, I just did testing last week for house and have plans on my desk. I don't, there's nothing that wouldn't hold him up at all. I mean, that's for you guys. I mean, if you did testing next week, you could theoretically get a plan in and get it approved. You still would have to get a plan approved for and a permit signed for the IA system. So again, wouldn't it just be in the applicant's best interest? Why have a maintenance contract and go through all that expense when you can just, the material seems like it's really good.
Much more money on putting in a new system that, you know, is going to mean clearing to gain access into the woods to do, bringing in new materials that aren't, you know, on site now to bring in. We have a working leaching field that's had 1/4 to 1/5 of its design flow going to it for 40 years. So it's working very fine. It's had a septic tank that's been regularly. It's had a Y upgrade, a working system.
We're talking about a 43-year-old system. We don't know what's happened. Again, it's in the past. Again, Title V.
What's happened?
Okay,
You have water meter
am
reading?
sorry, gentlemen and ladies. It is 6:22. We're going over a lot of the same ground. Please give us a couple of minutes to deliberate. So, Bridget, we have your recommendation that it be treated as new construction and require full Title V. And I assume then, well, actually, I won't assume. So you are also recommending against the deed restriction? I think
Yes.
that's what you're saying? Yes, okay. Trish, any thoughts on your end?
I have learned a lot the last couple of emails, reading a lot of these things that are way over my head, but listening to them be explained to me tonight. I agree. I mean, it's 43 years old, 40-something years old, and it's the new Title V. And I am concerned about that many rooms and what happens going forward. And I think that's where I'm coming from.
Okay, and my take on it is it's actually quite similar, that it really is new construction. It's a total rebuild. We have only documented a permit for a 1-bedroom. I think the jump from a system that's been certified for 1-bedroom to what really should require 4. I don't think that the deed restriction provides adequate protection in real time. It might be of some help somewhere down the road when and if the house is sold, but I think in real time as we live today, it does not offer adequate protection to the public health and safety. So my recommendation also is that we not accept the deed restriction. And yes,
May I say something, Tom Gibbons?
yes,
Yep. So it seems a bit arbitrary. I mean, the Title V allows for the deed restriction. If you totally throw out the usefulness of a deed restriction, then it makes it superfluous. You would never accept the deed restriction. It gets recorded. People are required to abide by it. Now, as a practical matter, you can say that well, people will ignore it. Well, then you'd never allow a deed restriction. You've got to, I got to say again, you've got a working system that's designed for the flow. Bruce has offered another alternative that will even make it even better. And it just seems arbitrary to say, no, we just want you to build a new system because we want to. You've got a Title V report that shows that it passes today.
no, I'm sorry. It seems to me that we're actually following the regulation, but thank you for your input. So I will then, I think we've had a lot of input, and I don't do this lightly. I mean, I understand that I have a strong streak within me that says that when you own a piece of property, you should be able to do the things that you want to do with it. So that this is not coming from a place that we're just trying to place unnecessary or arbitrary restrictions. But if I look at this scenario, no matter where in Ayer it occurs, if someone comes to me and they have a certification for a one-bedroom system, now they're replacing with construction that by current Title V, they need to have at least a four-bedroom system. Yeah, I just think that it's too much. So my recommendation is not to accept the deed restriction. Heather, do we need to vote?
Yes,
No. Yes?
yes.
Okay. Well, let's do it then.
Always
So-
vote.
All right. So I will make a motion that unfortunately it does not appear that it provides adequate coverage for public health and safety to manage this through a deed restriction. So my motion is that we deny the request for grant of restriction on the deed.
I second.
Okay, all in favor? Aye. All right, thank you, gentlemen.
Thank you for your time.
You are welcome to stay with us. We have a few more things on the agenda. You can choose to stay with us or you can go at this point. That's up to you.
Thank you very much. Have a good night.
Thank you.
Okay, thank you. Thank you for your time. Geez, where's my agenda in this huge pile of papers? What's
I'm
next
not
on
the
the
only
agenda? My God. Oh, Bridget's COVID. Bridget, what's going on? How's COVID?
Oh, sorry. I'm in my car now, so if I lose you, I'm
I
sorry.
understand. Yeah.
So essentially what we have is things are not looking good, unfortunately. I met with our town nurse today, and we have been somewhere between 30 and 50 cases per day for the towns that we cover. Putting that into perspective, that's about, some of our towns only have 3,000 people.
Yeah.
The people are being tested because they are in fact sick. I was informed today, one person had fairly young, a lot of trouble breathing, wound up in the emergency room. Again, we're starting to see more cases of that because the cases are increasing. And a lot of community spread, carpooling, friends, going out, and a lot of daycare as well. Basically kids, grandchildren are. We don't know if it's the kids spreading it to the adults or the adults are giving it to the kids. At this point, it's so hard to figure some of this out through contact tracing. I think we've mentioned some before. Back in March or April, people were staying home and the contacts were very minimal. They were minimal, maybe 3 or 4.
Right. Yeah.
Our nurses spent 8 hours on the phone 2 Saturdays ago just with one person's contact. So if you can imagine between 30 and 50 cases per day, and then trying to go back to the close contacts, it's very difficult. It's very sad because the reality is I started to do some of the contact tracing as well to help out. And, when you're talking to people that are sick and scared, it's frightening. So with that said, that's the doom and gloom piece of it.
Is there a particular age group that's?
I think 20 to 29 is the top group right now. And we have people, unfortunately, not being fully forthcoming about where they've been and, where they work and who they've been around. So it makes the contact tracing to notify other people very difficult.
Yeah.
I'm wondering about when you said the contact tracing, this uptick, it seems to be that it's more contagious, but that's because more people are getting tested. It's not a different strain. It's the same as last March and April, but it does seem like, I know myself, I'm hearing more in my inner circle of like relatives. When it came out in the spring, I didn't know anybody that had gotten it, and it kind of scary. But it is, the testing is more, and there's better testing.
Yeah. So but I stress to people, people are being tested because they're sick. In the spring, it was very contagious. The nurses said they sort of saw a break from that back, in the summertime.
Yeah.
And now it's back to the way that it was. It's very contagious. The breathing problems seem to be trickling back in again. So it went from very contagious to kind of not so much. People in the same household wouldn't get it. And now they're finding that it's back to being very contagious. And once one person has it in a household, usually the rest follow.
Wow.
And that's the sad part. And that's what's making it so difficult, because they're dealing with one patient. And then, 4 days later, they're dealing with 4 new patients from the same household.
Yeah.
And then they have to get those contacts.
Yeah.
So, and I think Shirley and Lunenburg had a big, some big hits over the past couple of weeks. And, we had neighborhoods that were affected because of Halloween parties and kids playing together. That's sort of something that I found out today. And unfortunately, that's our concern, is that after Thanksgiving, about 9 days later, we're going to see another surge.
Right.
Well, some of the high schools are remote now. I know the system I work in, their numbers were elevated, so their high school's gone remote. And there was that talk about shutting down between the holidays, but then again, you shut down Thanksgiving and Christmas, and then you go back in January, and then aren't you bringing holiday, transmissions? I know.
Yeah, and I mean it's very sad and it's disheartening, like I said, because it's we're seeing it and we're feeling it and we're talking to people, but if people aren't seeing it and feeling it, then they don't believe it. And I just talked to a nurse a couple of days ago who had it, and she ended up with pneumonia. I mean, she told me her story. She was a friend of mine, and she's 60, and she she got her, since she was diagnosed on Halloween, and again, it was when she had trouble breathing, she really was scared, and she ended up with pneumonia. And we're well beyond what her quarantine theoretically has ended, but it hasn't, because she's still sick.
Yeah.
So I mean, it's just, and she told me she didn't talk about it because she doesn't want to. I mean, they're embarrassed. And, I tell people it's nothing to be embarrassed about. If you don't talk, people don't know.
Right.
I think the best thing that we can do moving forward is just really keep reiterating to people, you can do things safely. You can, if your family circle has been, tight, and your, grandparents have been seeing the grandkids, and it's been you and the grandkids, and that's what your circle has been all along, you can still see each other, but you don't want to go outside that circle.
Right.
And I do want to say that, people ask me all the time, are the masks working? And, I've shared personally, I have asthma. I do not like wearing the mask. It is uncomfortable for me, but I do it because, number one, it makes me feel better. But number two, when you're out there, it's a level of protection. So with that said, we are finding that we're not seeing the transmission when people are wearing their masks.
it's happening after work when people are taking the masks off or when they're meeting with their friends from
Yeah.
work outside of work.
Yeah.
So when people ask me that, as a, Board of Health inspector, are the masks working? We have to say yes,
Yes.
unequivocally,
Yeah.
without a doubt.
Yeah.
And I do want to, stress that it's not a joke.
Yeah.
I'm not just saying it either. It really seems that even some healthcare workers that have worked in critical care units, as long as they were completely masked up wearing their PPE, it stopped the spread.
Yeah.
So
Yeah. Yeah. I get you.
that's my doom and gloom.
I know. And we at least do have some good news on the vaccine front, but just keep in mind that there's a lot of things that have to happen between FDA granting approval and then actually making enough vaccine and getting it out there to people.
Correct.
So
Correct.
I just, I caution against anyone thinking, but now we've got, if first there were none, now all of a sudden we have 3 possible, vaccines. But if you get it, the vaccine's not going to help you.
I have a question.
Sure.
Friends of mine, a couple about my age, are just recovering from it in another town. And she's a nurse also, and she's like, "Oh, I wonder how long after this, if I should volunteer to give antibodies." You haven't heard too much more about that for a couple of months. Remember, they had that conversation going, and they were looking for volunteers and get tested to see if they had the antibodies. Do you know anything more about that, Bridget?
So I would have them check with their, I always say start with your primary care physician.
Yeah.
And some of the local hospitals might have information on that.
Okay.
You know what, now that you said it, I agree with you. I've not heard much about that.
Yeah, it was big for a little while, and then you didn't hear anything more about it. So I'm just wondering.
Yeah.
So.
No, it's a good question.
Yeah. Yeah, it is. It really is.
All right. What else, Miss Pam? What else do we have on the agenda?
Just giving a quick look to see if I can find anything about donating.
Oh, antibody?
Plasma. Yeah.
Yeah, and I would think it would be in the bigger cities and bigger hospitals that you would.
I would think so. Like even maybe, I don't know about the hospital in Ayer, but like you might be able to get into
Mass
it.
General.
Yeah.
Mass General, Emerson.
UMass.
Yeah.
Something like that.
She might find some interest, but that is a wonderful suggestion.
Yeah.
It's a good one.
It just makes you think, people are recovering.
Right. So what can you make good out of
this until a vaccine is readily available? Yeah.
Yeah, exactly. And I my guess is maybe some of the really high priority people will get it this year, but I think we're looking at like a spring until
Well, I think the other thing too is
available for us.
One of them requires 2 doses.
Yeah.
So then there's another one that requires the temperature to remain at minus 97 degrees Fahrenheit.
Yeah.
Right?
So I don't know about the other one. But I do know that in the getting 2 vaccines, that poses challenges as well.
Yeah.
For issuing those, and
it does.
But I guess stay tuned and see what comes down the pike.
Yeah. Okay. Well, that's all that's cheerful. So I feel like a school mom every time I say this. Oh, Red Cross. It says,
oh, really?
Contact the Red Cross. Here we go.
That would make sense.
There you go. That would be a good place to start. And then they can probably direct you for your physical location where you can go for collection. All right. Yeah, and people stay just use your heads for Thanksgiving, please.
Yeah.
All right, thank you, Bridget. Do you have anything else from the Shelba that we should be looking at now?
Heather, did I bring the envelope last?
You did not.
Okay.
I have a
Last
So I
couple
don't
things
think
for
there's,
you.
okay, so I don't think there's too much in there. We're still waiting for, information from Steve Wenzel on Amy's place.
Yeah.
I haven't gotten anything on that yet. And then, I mean, that's really it for now. I mean, to
Okay.
be quite frankly honest, it's just, we have
I
been
know.
dealing with the
You have other
COVID
things on your
questions.
mind.
Yeah.
Well, it's just,
I get
you know,
it.
in the past week and a half, I think we've had 6 restaurants that have had to close because they have, you know, and they're closing because they don't have staff. Because if
Yeah.
someone's diagnosed, you know, the close contacts all have to quarantine.
Yeah.
And it's a pain when you have smaller places and they don't have a lot of staff. So
Yeah. And restaurant kitchens are just close places by the nature of
yeah.
it. Oh, wow.
So
Well, I'm glad that you brought up Mr. Wenzel, because I needed to check with you, Bridget, on dates for 2 different things. So one is that we continued to December 14th, the public hearing for Casamana. Should we reach out to him and see if he needs more time? You say you haven't gotten anything.
So I was gonna wait till after Thanksgiving to see where we stand.
Oh, that's yeah, that makes sense. Yeah.
Just to give him more time and, you know, take it from there.
Yeah, and I would tell him, if you do speak with him, that if he can answer some of our questions, then do that. Take it a piece at a time. You know, he doesn't have to wait until he has all the answers ready for us. So if he wants to, you know, submit information piecemeal, he can. But we'll assume that he's still, you know, is going to meet with us on the 14th then of December. And the other thing that I'm just going to move up a little bit on the agenda. Well, actually, it's not on the agenda. So it's kind of a new administrative matters that just kind of popped up. And it's replacing our board member. So we have 2 people that have submitted applications. And Robert Pontrian sent me an email today saying that we could be on the selectmen's agenda for December 1st, but they do the tax rates at that meeting. So, and we would have to come after that. So I think that means, you know, we probably wouldn't come up until around 7 o'clock or so. And if we don't want to do it next Tuesday, the next available is December 15th. So if you can do the 1st, I don't know, maybe Cindy, I don't know if there's a way that, you know, like, can you text us or something when it looks like it's time for our thing to, you know, come up, and maybe we could just join into the meeting then. I don't know how long the tax discussion usually lasts.
Yeah, I think it
Pam?
depends.
Yeah.
Just a thought.
Yeah.
Do you guys, and I'm just throwing this out there, do you want to push it off a little bit? Because you're going to probably want to look over their resumes and then discuss it at your meeting first and then follow up with the selectmen?
Well, that's a good point. Yeah. I'm kind of balancing. I would like, of course, I'd like to fill that position as soon as we can. I would like the new person to dive into all of the Casamana stuff probably as soon as possible.
Yeah.
But yeah, I don't think that's going to be resolved entirely at that December 14th meeting. So I don't really see a big risk in. Oh, hang on, let me get rid of that stupid telemarketer call here. Oh. Okay, I got rid of him. So what do you, I don't know, what do you think, Trish, given that? Do you wanna
I
do-
agree. Bridget, it's been quite a while now that we haven't had another member, and I thought maybe at that meeting, but I could go either way with it now, Pam, that you said it's probably not going to be resolved quickly. So
Yeah,
I don't know. There's only 2 applicants. I don't think there's a whole lot of discussion, and the posting is closed, so
yeah,
it would just
yeah.
be
So
a
what we got
discussion
is what we
about-
got.
Yeah, it's just
Cindy,
two people.
do you know, Cindy, roughly how long, like this is the tax rate
Excuse me, yeah,
setting, or?
tax classification hearing. Typically, the select board assigns times to their agenda items. So you should
Ah, right.
feel for approximately what time they're happening.
Okay,
Sometimes things can run longer. I haven't actually been to a tax classification hearing for a while, but I think the last one was
okay.
half an hour. But they're usually pretty good at putting times to their agenda.
Yeah.
Okay.
Or like
So what do you think then, Bridget? Should we do it on the first and just get somebody in the seat, and then they can start learning the Casamata thing from the beginning?
Yeah,
Okay.
I mean, it's totally up to you.
Okay.
The other question
All right.
I have is, because I've never done this before, is
Neither
this,
have I.
when you have an applicant that is going to be recommended, does the discussion where it's just Pam and I, is it a public discussion, or do we
So
talk?
Yes.
I've gone through these
Yeah.
before.
So
It's a
Yes,
where,
I think it's the
meeting,
3.
yeah.
go
Yeah,
ahead.
I've done these before. So what happens is you have a joint meeting with the Board of Selectmen. So it's essentially the 5 of you. You
Okay.
interview the applicants, ask them questions on all 5 of you. It's open to that. And then you make your recommendation and vote as a whole. It's
Okay.
essentially 2 votes, but it's one as a whole vote to recommend that person.
So
Okay.
the two applicants would be at.
They'd be at that meeting. Yep.
So
And you ask them
December
questions.
1st?
Yeah.
I've been on the other end of that. I've been appointed to several boards over my course of my time.
That's
here.
how I got on Board of Health.
Yeah, that's how I got on the
Yeah,
Conservation
yeah.
Commission, in the Planning Board, and now the Zoning Board of Appeals. So
Yeah.
So you listen, it's a public discussion between everybody, and then you give your recommendation and you vote all in one meeting.
Yeah.
yeah, it's all in one meeting. That way, it saves time. That way, you're not giving you're not meeting with them, giving your recommendation. The Select Board's not meeting with them,
Yeah.
doing it, and have it being different. Everyone's doing
Makes
it at the
sense.
same time,
Yeah.
saves time. I mean, you only
Yeah,
have
and it
two.
is only the 2 applicants.
Yeah, so as I went through with Planning Board twice already in this town, so it's not too bad.
Okay. All right. So, and Bridget, you attend that meeting as well, correct? Because we would like your input.
No,
No?
You don't?
no, I don't. No, it's not. It would be you and
It would be a board.
Trish.
Well, that's true, Pam. It wouldn't be, because wouldn't it be a little bit of a conflict if she's going to every town and we're just one town? I mean.
Bridget's stacking her boards everywhere she goes.
That's what I mean. What if he's not?
Oh, that's what she's up to.
No, I'm not saying conflict of interest. You know what I'm trying to say, Bridget?
Yeah. No, I mean, I can.
No, I just assumed you weigh in.
No,
No.
Okay.
that
All
is.
right.
Okay.
Well, please.
I'm just the agent,
I know.
and
I'm just
we
the
do really
agent.
value your opinion. So if you would please then consider it as a favor to us, would you take a look at the information 2 applicants sent in and just, maybe give us some thoughts on it
absolutely.
to further inform our decision? Okay, then I'm going
Yes,
to
absolutely.
I will reply to Robert then that we are good to go for December 1st. All right, thank you.
Is it okay if I
Yes.
head out?
Yep, that's why I
Okay.
moved all your
Thank you.
stuff up. Okay.
Thank you.
For all your
Have
help.
a good evening. Bye-bye.
Bye, guys.
Bye.
So we have, Trish, 2 minutes to look at. We have the minutes.
Yes.
Oh, not Bridget. Did I just call you Bridget? Oh
No,
my gosh. Trish,
yeah,
we have 2 minutes that we need to take a look at and approve or modify. So we have November 9th and we have October 28th, which that's a good job, Heather. Your notes
Thank
are-
you. I was struggling with those ones because there was so much that happened, but it was a lot
I
of ground
know.
about
I know.
information. So I was a little worried about that, but
No, I thought that was really a pretty good summary. I think you got the gist of the information, and you're right. It was a lot of discussion to distill into this. So my compliments for
thank you.
yes.
doing that well.
It's nice to know that minutes are appreciated.
Yeah, of course they are. I don't want to have to do minutes. I am terrible. Would never have minutes. Or they would have like 3 bullet items.
Yeah.
Open meeting, discussed, closed meeting. Okay, so have you had a chance to take a look at either or both of these, Trish?
I
And-
looked through them. They looked fine to me. Did you see anything that you have? Any?
I didn't. I just saw, I don't know, there's like a couple of like stupid like typo things, like
If you
the
just
small
wanna send them-
words. Nothing
Where?
big.
Send them
Well-
to me, Pam, and I'll correct them before I get them signed and posted.
All right. That's fine. So then, given that, and they're just like dumb little, you
Yeah,
know,
that's
like
that's usually what I
easy
get.
typo stuff. Yeah.
Okay,
So given that, I will move that we accept and approve the minutes of our October 28th, 2020 Board of Health meeting and the November 9th, 2020 Board of Health meeting
I
minutes.
second.
All in favor?
Aye.
Okay. So do you want to just check them out then, Heather, and send them again? Or-
Yeah, I'll do that, and then you can just take turns signing them, and then I'll get them posted.
Yeah, did that work for you last time, Trish?
Yeah, that works. I'd hate to post minutes that have minor errors on them because
Okay.
over the past few years, I've definitely gone back 10, 15, 20 years in minutes, and I'd hate to have someone read a little minor typo in my minutes.
Yeah, I know.
Okay.
I know exactly how you feel. Okay, so that's that. And you were able to open the scan, right, Trish, and sign? Or did you just sign and scan from the
I
last
did
time?
not scan and sign. I can, do you want me to wait? On,
No, I was asking, so like for the last minutes, I signed it and then scanned the signed ones
right,
and I emailed them to you. Were you able to print that with my signature and add yours?
that was for the October one.
That was from the last.
I've only
meeting.
done that once, so I haven't seen anything else
Oh,
that was sent for me to scan and sign.
oh, all right. Let me.
As I said,
check.
I've been having all kinds of trouble with this. I
Okay,
don't know how I was able to print tonight's minutes, but not the agenda.
that is
I know.
that is really weird. Hey, you need to spend some time with Cindy.
Well, no, not only
You
that,
need a computer.
I had said earlier, Heather, when it used to come through in an attachment, I could just click on it instead of having to download it, and I could, boom, print everything right out of an attachment. But when it's a PDF or something else, I have to download it, then go into the downloads and try to print it, and I am not successful at that. But I
I
do.
always send the agenda though in a separate email with everything in a Word, and then it only comes through as a PDF when it's the Zoom link. So
Okay.
Yeah, and then anything I send,
anytime
if I
anybody has
sign and
any issues
scan.
getting something, just let me know. I can always print them and tape them outside to one of the doors if you want to grab physical copies. I can do that too.
No. Pam, did you figure out which one did I miss then?
Well, that's what I'm going back to see, because we had approved some minutes in our last meeting. Geez, I hope I remembered. So they would have been the minutes from September 24th.
Yes, that one, that was.
You got that?
That was the first time I did that, and you sent them to
Oh,
me,
okay.
and I scanned them and sent them back in, but this time, no.
Okay, all right.
So-
Then I'll, wait, just let me know, Heather, send me then these after you've done what you want to do to them, and I'll sign them and scan and get them over to Trish.
Okay,
Yes, okay.
I can do that.
All right, and just, you might want to just check and let us know, are there any minutes that you know of that we haven't both signed? Because if that's the case, then we'll just do another signature
Okay,
if we're missing something. Okay.
okay.
It's not
All right.
not as easy as it was passing it around the table and giving it to John Hancock and passing it on, and that's it. So
Yeah, well,
I'm just trying to make myself feel better. So
There's a lot
technologically
of things that
prepared.
aren't as easy as they were.
yeah, I know.
All right.
So anything in the way of mail or bills?
Oh, but I just need Trish to second that motion, you guys to vote, because you
Oh,
just did a bunch of discussion on the minutes. You didn't actually second and vote.
Yeah, I
Okay.
said I second it.
Oh, did you? I'm sorry, I must have
That's
missed
okay.
that.
do we have to do it over? Are we okay?
No, you're good. I'm sorry, I must have.
I think I heard her second it too. 'Cause
Thank you.
That's when we did the vote. Okay. Mail or bills? Anything require our attention?
Not at this moment.
Okay, that sounds good. The fiscal year 2022 budget request. I received the worksheet as I have in the past. Thank you, Heather. So that had, what have we spent so far? What was our
Yeah.
budget for last year? And Robert needed to get all of those forms back from last Friday. So I just sent it back in with level funded, exact same amounts for the next fiscal year that we had for the last one. And I just wanted to get that okayed by you tonight. So do we have to vote on that, Heather?
I would vote on it just to be safe.
Okay, then I will move that we vote to accept the proposed fiscal year 2022 budget that I just emailed to Robert, which was level funded from the previous fiscal year.
I second.
All in favor?
I
Aye.
Thank you.
we needed.
Sorry, that was a long convoluted one. Okay, and so we're winding down to the end here. Status check on Board of Health permits.
Yep, so
Anybody giving you trouble?
No, I sent them all out. I'm starting to get them in. Trish, do you want me to, Pam, do you want me to just make the permits up and mail them to you and have you send them back? So I can get those out?
Yes.
Okay, I will
Yes,
try to get those
absolutely.
in the mail this week for the ones that I've gotten back so far.
Okay.
And then I'll
Or-
send out the second notices next week.
All right. And these are all the trash haulers.
These are trash haulers and tobacco, because they're both due at the end of the year.
Oh, yeah. Tobacco,
Yeah.
people are usually pretty good about, because they
Oh, yeah,
know
no, they
that's a
have. They've been coming
serious-
in, so we're
Okay.
doing good.
that time of year.
Yep. Okay, yes, you can either mail them to me and I'll mail them back, or if it's something that you can email me, you can do that and I'll sign them
Yeah.
and send them back to you, whatever
Okay.
works. Okay?
All right.
Oh, and last but not least, action items for December 14th. So I think December 14th, we hopefully will be welcoming a new board member. And we have a continuation of the public hearing for Casamana. And I think that actually might be, especially if we have a new person that we're bringing on board, I mean, we'll keep our usual, we want the update, the COVID update from Bridget. Minutes. I did ask Lori Nearing and Laurel Shader. It's always a tough one for me. If we could, hold off until after the first of the year so that we can get through all our permits and these, public hearings and stuff. So they will not be at the next meeting.
Okay.
So I think it's the continuation of the public hearing and then kind of our usual items and then take another look at permits and make sure that we're looking good there.
Okay.
All right. But, do it the way we always do. Send me the draft and,
Yep.
I'll make any changes we need to.
Okay.
Oh, anything else? No? Okay. Perfect. All right, then. Want to make a motion, Trish? I made a lot of motions tonight.
I'm adjourned November 23rd Board of Health meeting
Yeah.
at 7:01 p.m.
All right. Seconded. All in favor?
Aye.
Aye. All right. We are adjourned.
All righty.